Hello everyone, in this video we will continue with immune thrombocytopenic purpura or idiopathic thrombocytopenic purpura with the pathogenesis. As we have discussed earlier that ITP is autoimmune type of a disorder. So autoimmune disorders which is characterized by the formation of antiplatelet antibodies. So ITP is autoimmune disorders that is characterized by the formation of antiplatelet antibodies which is directed against membrane glycoproteins, most oftenly GB2B, 3A and GB1P9 of platelets. So these are the receptors in platelets that you will find, and the antiplatelet antibodies can be demonstrated in approximately 80% of patients and are of IgG type. And this mechanism of platelet destruction is similar to that is seen in autoimmune hemolytic anemias, where autoantibodies are developed and they destroy our normal cells. So similarly, even ITP is also destruction of normal platelets by the immune system. So the antiplatelet antibodies acts as opsonins and are recognized by the IgG-Fc receptors that is present on mononuclear phagocytes of reticuloendothelial system, mainly in the spleen, and are destroyed there. That results in thrombocytopenia. And spleen is not the only major site of destruction of platelets, but also a very important site of autoantibody synthesis. Therefore, splenectomy, that is the removal of spleen, shows a marked improvement in about 70 to 80% of patients suffering from ITP. Okay, although destruction of sensitized platelets is the major mechanism responsible for thrombocytopenia, the autoantibodies probably also affects production of platelets by the megakaryocytes and also impair the platelet function. So that's why after removing of the spleen, the patient shows a marked improvement. Okay, so now let's come to the diagram of pathogenesis. We can see that this is a platelet and we have the receptors GB2B, 3A and GB1B9. So these receptors, against these receptors, autoantibodies are formed. Antiplatelet antibodies are formed against these receptors, which attach to the receptors. As you can see in the diagram, this antibodies comes and attach to receptors, and with the FC receptors, with IgG FC receptors that is present here, that is present in the mononuclear site, they come and attach here. They come and go to the spleen. So mononuclear phagocytes recognize the antiplatelet antibodies here in the spleen, and destruction of platelets by macrophages happens here. So that is how platelets are being destroyed and thrombocytopenia occurs. So that is all about immune thrombocytopenic purpura. I hope you have understood with the pathogenesis. In the upcoming videos, we will discuss with the lab diagnosis and the summary. Thank you.